And we are right at it. We are ready to go. It is 3 minutes after 11. Dr. Payne Show. Dr. Payne is here and ready to rock. Some big changes coming down the pike, right, pal?
Yes, sir.
But that's soon. That's not yet. But
Not yet.
Well, you know what? Give some details on it anyway. What's on the horizon?
Yeah, so I mean, one of the big things that we're working on is changing to a more consistent brand, Pinpoint Health. Some of the clinics have already changed the name over to that, but website and all those things, we're just moving away from it. It's funny, one of the things that I always said was part of the psychology of treating pain is you shouldn't really use the word all that often. And with the name of Pain Care Canada, it's sort of always in your face. So from a actual treatment and prognostic perspective, it's actually better not to use the term. And we definitely wanted to go with something more holistic. And also the fact that we're not just treating. See, the funny thing is people think pain means like sharp, intense pain. It can also, some people, you know, when I see them and I'm just so used to saying, so where's your pain? And they say, well, I don't have pain, I have numbness. And it's like, okay, well, that's sort of what I meant, but you're right. Like it really isn't the right descriptor. So there's more than we're doing than just pain. So, and a good example of that, actually, today I have my little cousin here who's studying media studies at Humber College. Has been doing a lot of work with us at the clinics, taking new pictures, videos for website and things like that. And on the way in, I picked him up and he was talking about his thumb. And I said, stop, let's just do it on air. Ask me on air. It's a good thing for people to hear and see how the sort of the consultation goes. So, Remy, welcome.
Thank you, Lou.
So what's going on with that thumb?
So, you know, I mean, for the past week, my thumb has just been, I've been having some weird pain, and I go, you know, that's weird. I've never had that in my thumb. And I go, out of all people to ask, I go, I should ask you today.
It'd be nice. It'd be nice.
It'd be good to ask the doctor himself. But I go, you know, I've never had pain in my thumb like this.
Now, you were saying when we were driving, you said something about it sort of feels like a nerve pain. You use that.
Exactly. So it does feel like a nerve pain in my thumb, and it does carry out to like my arm as well, and I don't know, like just within the last week, right? So,
yeah, and the reason why I wanted to bring it up, because this is interesting. So a lot of people, I'm going to use the term carpal tunnel, and people often think that carpal tunnel just means pain in the wrist, but actually what the carpal tunnel is a tunnel formed by the bones in the wrist where the median nerve passes through. And when that tunnel is aggravated for whatever reason, specifically in our day and age, it's really computer use. So having your wrist an extension, and Remy being in media studies is using cameras a lot, computers a lot, so his wrists are often in awkward positions. If you put enough pressure on that tunnel, you irritate the nerve, and that nerve travels to the thumb, the first finger, and the second finger, and it also travels back up. So that's pretty consistent with what a carpal tunnel syndrome is. And so a lot of people will often say carpal tunnel, and they only mean that for wrist pain, but most often wrist pain is just simply sprain or strain. It's actually not affecting the median nerve. So you probably have a little bit of carpal tunnel. I mean, you're young, you're healthy, so I'm not concerned of anything more serious than that.
Yeah.
But definitely with the things that you're doing day to day, being in school and a student, you're going to aggravate that wrist. So then the question becomes, so how do you treat something like that?
Yeah, exactly.
And really with this type of stuff, it's really about keeping that wrist. So it's the continual sprain strain of that wrist that aggravates the nerve, so the flexion and extension of the wrist. So one of the things that I often recommend to people with carpal tunnel syndrome is that at night you should be wearing a splint that keeps you in a neutral position, and you should do that for about 3 or 4 weeks. And the reason why I pick nighttime is during the day, people, when you're conscious, you know what you're doing with your wrist. But at night, people sleep in all kinds of weird, awkward postures, and they don't realize how bent their wrist might be, and it just puts nerve pain. And that's why there's a lot of people complaining of nocturnal paresthesia, which is people waking up saying, oh, my arm, you know, I wake up in the middle of the night and my whole arm is numb. Well, that's often because of a positional issue, the fact that you're just sleeping with either your neck tilted to one side or your arm is bent a weird way. If you put pressure on a nerve, it falls asleep. And
tell me about it.
Yeah, and I mean, the best example of that is everyone can think back to their elementary school days when you're sitting cross-legged on the floor and then you get up and your whole leg is numb and you can't feel anything. That's just pressure on the sciatic nerve. So, Remy, I think you got to wear a wrist splint for about 3 weeks. And
drop the 300 hours of Candy Crush a week.
I think
right? Remy, come on.
Exactly.
The Fortnite.
Yeah, 100%.
Too much playing Fortnite, exactly.
Yeah, so anyways, so those are the things that are going on. So yeah, we're changing overall to a consistent brand, but still
Beautiful.
providing the same great service. It all starts with a free consultation, and that can happen here today. So anybody listening, give me a call. Let's talk about the issues you got going on.
And you've always had an oversight or overseeing the clinics that you've used, but now they're right under your umbrella, so you have more control, and the consistency is going to be even greater moving forward. So that's all good too, right?
Yes, sir.
Yeah, 416-870-6400, 416-870-6400, star 640 on cell. You have some issues happening with your health or just curious, give us a call. Phone lines are open just before 12 o'clock. Plenty of time here. Dr. Payne Show on Global News Radio. You bet those phone lines are open, 416-870-6400, star 640 on cell. It is a live call-in show. You have issues, bring them on. This is the hour you get some answers or get the ball rolling anyway. It obviously no need to mention anywhere on the planet that it is basketball fever, especially in this town for the next few days. And, it doesn't matter what area, what neighborhood you go to in town, all of a sudden you see this influx of kids out there. They're all shooting hoops, whether it's in the schoolyard or in gym. Everyone's just feeling the fever. And a lot of these guys go down with shoulder pain, whether they're taking falls or whether it's just from doing the actions of basketball. It's a big thing, right?
Shoulder pain, yeah. It's funny you bring that up. Remy over here is a huge basketball fan. He was, I remember when he was young, he wanted to be a basketball player when he grew up, and I was like, short Italian guy. We're not going to break it to him yet, but he's eventually going to realize that.
I remember actually, I even said to you as a kid, I said, Luigi, is there anything I could do to be taller? And you said, Remy, you see your dad over there? That's about it.
There's a genetic limit.
Yeah.
I remember when my son was born 4 or 5 months ago, the doctor came in and was measuring, and he's like, "Oh my God, he's really long. I think he's going to to be tall. Yeah. And I looked at Jocelyn and I was like, I bet against that. Yeah. I would bet against that. But
Remy's going to be the new Muggsy Bogues. He'll be the shortest guy in the NBA. Well, from the waist up, anyway.
My mom actually, she met Chris Bosh one time, and I was emailing Chris Bosh as a kid, just for some. Just for some advice to keep motivating me to play basketball. And actually, he told me, he's like, don't discourage yourself. Muggsy Bogues was 5'4" and this and that.
Yeah,
but
well, your basketball career is over, so don't worry about
that was it.
Anyhow,
I'm done.
Yeah, so shoulder pain for sure, obviously with basketball, and I mean, there's a lot of injuries that can happen with basketball, but it's good that you bring up shoulder and shoulder issues. I often say are very, very tough issues to treat properly. One of the nature of the joint, right? Yeah, the nature of the joint, it's a big thing. Like, if we look anywhere else in the body, the nice thing about other joints, like if we let's just pick the knee, for example, or the ankle, they're very much structurally sound, so they sort of fit together nicely like a puzzle piece. And there's a lot of things sitting there versus when we're dealing with the shoulder, it fits together like a puzzle piece, but if you didn't have ligaments and muscles holding it there, it would literally just fall off. And so that provides, and also the amount, what we call the range of motion or the liberty of motion of that joint. I mean, if again, going back, so let's pick the elbow. We only have two motions there, flexion and extension. Whereas when we look at the shoulder, we not only have flexion, extension, we have abduction, adduction. We can roll it around. There's a lot of degree of movement.
Right.
And so that degree of movement creates a complexity when we're trying to treat it and when things happen. And again, the shoulder is a funny thing because what I most often see in practice is that people call or people come in and they say, I have this shoulder pain. I had an ultrasound done and it shows some degenerative tearing, and I was told that that's the cause of my pain. Often not the right answer.
Right.
Could be, but you got to correlate it. You can't. The problem with imaging is it can't just be an imaging diagnosis. This is why even when you read a report, an imaging report, it doesn't say diagnosis. It says impression, because the radiologist does not know what the person is happening in your office clinically, and so you have to correlate that. And degenerative tearing is very much just like degenerative arthritis of the body. It's going to happen. Everyone's going to have some, depending on the age. Is it more than we would expect at that age, or is the severity of it worse than we would want to see at any point in time? So those are the things, and don't be fooled by that. Don't think that it all comes down to that ultrasound diagnosis. Yeah, I have a tear. I was told that I have a tear. I mean, we could take 100 people right now and give them an ultrasound, and we'd probably find 50% have that same tearing, but not the same 50% have the pain. And so that's an important thing to correlate those two things.
416-870-6400, star 640 on cell is the way to go. Annie, thank you for hanging on this morning. How are you?
Thank you. Terrific. Thank you.
Sure. What's going on?
Thank you for taking my call. I'm going to be brief. This is the first time I've had pain in my body.
Oh, wow.
And I'm
good for you.
I'm just over 90.
Oh, wow.
And this is what
if that's as bad as it gets, I think you're doing fine.
Yeah, no kidding.
Yes, it's a sin to feel so good, but this just creeped up.
Okay. What's going on?
Weeks ago, I start to feel under my arch on the left side of body, vertically below the large toe, it's just a soft feeling of a slight soft pain. And it occurs only from time to time, and never when I'm stationary. And sometimes when I'm walking barefooted, it eases all the way from on the back of my calf. Sometimes it goes further up to my hip.
Right.
And I walk it out when there's a pain. I just do race walk and walk it out.
Okay. And so this has been going on for a few weeks. You mentioned.
That's correct.
And so let me just try to understand this. It's primarily at the bottom of your foot, just under the big toe. But you're saying sometimes it feels like it shoots up your calf and all the way to your hip.
It doesn't shoot. It just goes softly up my calf, and it's not under my toe. It's under the arch.
Under the arch. Okay, I see.
Area.
Right. So, I mean, that you start in that scenario, I start to think of like once somebody starts to say that there's sort of a connection of that pain, I start to always think, could it potentially be a nerve issue, like the sciatic nerve, which comes from the low back, runs into the buttock, comes down the leg, splits, and then goes into the foot. You're sort of describing that. Now, obviously, I can't diagnose you over the phone. Sometimes it can also just be muscular tension. The same way nerves follow a path, muscles follow a path, and there's something called fascial links between things. Have you, in the last little bit, been doing anything new?
Nothing new.
Nothing new? You haven't been walking more, anything like that?
Nothing new.
Yeah.
I've been doing the same thing for almost 100 years.
I'm still shocked because I think I remember this must have been about 7 or 8 months ago. I had a lovely lady that came in to see me, and a very similar scenario to you, and she had just developed some, I believe it was knee pain, and she was there with her daughter, and usually I always look at the age on the intake form, and I didn't this time, but this lady that was sitting in front of me looked absolutely amazing, and I thought she was probably 70 years old, and we're going through this knee pain, and I spent about 45 minutes speaking with her, and then I said, by the way, how old are you? And I went to look, and she was 99 years old, and I was like, wow. Oh my God. I was like, you need to leave. If this is as bad as it gets, you're
I'll have what she's having.
Yeah, you're absolutely fine. So I mean, the body, it's probably hard for you to hear this, Andy, but as we age, the body does break down a little bit.
Got it.
But I think you're doing great, which is amazing. But I'm happy to see you and see if we can figure out what's going on.
Andy, appreciate the call. You want to follow up? 1-855-55 Lou, DRLOU. And for now, info@paincarecanada.com. Sounding amazing, doing well. Keep it up. You're fantastic. Your calls as well, 416-870-6400, star 640 on cell. Dr. Payne Show would love to talk to you right here on Global News Radio. Dr. Payne Show continues here till close to 12 o'clock. Plenty of time for you to call in with your concerns, pain or otherwise. And a big shout out again to Andy for calling in, who's in her 90s. And sounds
awesome.
Sounds better than us.
That's awesome. I'm always perplexed. Like I'm 33 and I'm falling apart. Yesterday I was golfing and now it's funny. Before my injuries used to happen with like actual movements and things, and I'm golfing and I'm pretty sure I tore a meniscus yesterday in my knee from golfing. Oh man! And what's funny? I was golfing and Adrian Ross, who's a colleague of mine, was with me as well. He's treated you.
He's treated me. Yeah.
And so we're going, and my knee was really bad, and I was like, oh man, and I'm pushing through it, and he's like, are you an idiot? Like, just stop if it's hurting. I was like, I know, it's so true. It's so hard that, like, I'm giving this advice day in and day out to people, and then when it comes to your own health, you almost, it's like you become ignorant and you forget everything that you've ever learned. And so I was like, no, I think you're right. I think I need to stop and just let this thing heal. But before we go further, because Remy told me, he corrected me, it's Guelph Humber. I think before at the beginning
Correct.
I said Humber College, and it's Guelph Humber that he's at.
That's
And
right.
apparently that's a sticky point. And so before I get in trouble any further and I get called calls from Guelph Humber, telling me what am I doing with their students and stuff. So, so knee pain too. That's a big thing, and it's surprising. I've had some mild knee issues throughout my life,
Right.
and never really anything bad. But what was sort of, I guess. Sometimes sometimes I feel like it's a blessing in disguise that I've suffered so many injuries, because I think, especially for what I do, it gives me a better understanding. So sometimes I don't go looking for the injuries, but sometimes when it happens, it's like, oh, that's what that feels like. Like it just provides a new layer that you can't learn out of a textbook or learn by talking to somebody. And I was pretty surprised yesterday with how little it took to hurt my knee and what it actually feels like when it's pretty severe. And so it's pretty debilitating. Like, I woke up this morning, I'm hobbling around. It hurts to sort of sit, and I'm trying to kick my legs straight. And so, those are things that are significant. Like, they definitely can affect a person's quality of life. And I think that's a big thing with loved ones. And I always say this, that people always minimize what someone else is feeling, and it's always like, oh, you're fine. Like, no, but sometimes when you have a significant injury, you're not just fine. It does affect every part of like even your psychology. Like, I love to golf, and in my head I'm thinking, like, am I not going to be able to golf for the next few weeks? Like, that sucks to think that. And so that's the important thing about getting assessed early with these things. And I'm going to go get this checked out, and I'm smart enough not to be my own doctor. I'm going to get someone else to check this out and get some treatment on it, just to make sure that we're dealing with it the right way.
416-870-6400, star 640 on cell. That's the way you want to call through for the remainder of this show. Get some questions anyway, at least get a ballpark answer and take it from there. Get to Marco. Hey, Marco, how are you, pal?
Not too bad. How are you doing today?
Good, man. What's your concern?
I got an issue with my shoulder. They call it frozen shoulder. They call it all sorts of different things. But basically, the bottom line is bone to bone in the ball and socket.
Right.
I was speaking to my boss a couple of days ago. His wife did the stem cell injection into her knee, and like 2 days after, she was back to normal. I don't know if you guys do it here.
So I believe up until a few weeks ago, I would have said no, that it doesn't happen in Canada. But I think I remember hearing that there's some places that are starting to do it. As for its efficacy and how well it works, I can't comment because I haven't reviewed enough. I mean, I can walk you through the theory of it. Stem cells are what are immature cells, and immature cells. It's sort of like even, and I know this because we just had a baby, and what we did when the baby was first born was we took the stem cells from the umbilical cord and we're storing them for the rest of...
That's what my boss said.
Yeah, for the rest of his life. And the reason why that happens is there are some types of cells that don't regenerate very well, and some don't regenerate at all. An example of a cell that regenerates very well is skin. We can get a cut on our skin, and then after a few days, a week, it's healed, and our skin looks the same as it did before. So that heals very well. But things like, say, a nerve cell does not regenerate, which is the reason why when people suffer spinal cord injuries, they never recover fully. And so the idea with stem cells is that we're taking what are these immature cells that can essentially become any other type of cell and re-injecting it. So the thought with a lot of the knee stuff is that we're taking these immature cells, we're injecting it, and potentially it's becoming cartilage, and now you don't just have bone on bone. Now you have a layer of cartilage in between that joint. I think with all new things, it's a lot of it is a quick fad where it sounds cool, and so everyone thinks it must be the next best thing for everything else. I really, my point of view is I don't think healthcare works that way. It's always about matching up the right candidate with the right therapy. And one of the most dangerous things that I always say is talking to just the average person, right? Like, I want a PRP injection because my cousin's brother got it done. And that's a dangerous thing. That shouldn't be the way healthcare is done. What should be done is you need to get...
Doc, this person didn't do it here. They did it in the States, and I think it cost them
it costs a lot of money, that's for sure. But the point that I'm trying to make is you're jumping to a conclusion on what the treatment intervention should be. My thought is always start from what the diagnosis is, and then let's match up the best treatment option with that diagnosis. So I'm happy to see you for the issue that you've been having in your shoulder, and
Actually, I saw you about 2 years ago.
Oh, okay.
Your recommendation was total replacement. I'm running from that.
I see. Okay, well, hang on, and we'll talk a little bit more after the break.
Dr. Payne Show rolls on. Plenty of time for you still to call in. 416-870-6400, star 640 on cell. If you have issues, this is the show where you want to call in. Marco, thanks for hanging on, fella. Back at you. How are you?
Not too bad, thanks.
All right.
This is Marco.
Yeah.
Yep.
Yeah, Marco. So you were saying that I saw you and you need a total replacement. Yeah. So see, the thing is, total replacements of like hips and knees are I shouldn't say easy, but they're easier and they're done so often. Replacements of the shoulder are very tough. But if it's bone on bone, then that's an option. In terms of if stem cells are an option for that, honestly, you'd probably have to go to a clinic that does it and get their opinion. I don't know enough about it to make that recommendation.
I was trying the collagen, and it brings some relief, but it's a long, over 3 months I've been using it.
Yeah.
So I don't know, but to be honest with you, I don't want to go down the road with the steel and plastic.
Yeah, I mean, and listen, nobody can force you with what you want to do. It's just we make the recommendation based on what the best options are. And when it's bone on bone, that's what's creating the pain. The best option is replacing that joint. Now, again, I won't lie to you. Shoulders are not an easy shoulder or an easy joint to replace. It's a pretty complex procedure, but if necessary, it's about considering it. But hey, if you can manage it, I always tell people, if you can manage your issue without going to the more invasive steps, as long as you're able to live within the quality that you want to live, then you do that for as long as you possibly can. Now, the other thing with surgeries that are that significant is a lot of people want to. I see a lot of people that sort of two ends of the spectrum. I'll see people who are in their 40s and 50s and probably could use a joint replacement, and I tell them to hang on for a while before they start considering that if they can, because they're still relatively young. But then sometimes I get people, I had a few people this week that are in their 80s and are now at the point where they want to get their knees replaced, and they were told that they should have done this 10 years ago, and there's sort of a happy medium, because if you do it in and around your early 70s, then the good thing is these joints tend to last on average about 15 years. You probably won't have to do another one. The advantage is you're still relatively young and health is...
No, I'm in my 60s, man.
You're on your 60s, so that you're young. But 60 what? 61. Okay, so you're still on the young side, but don't wait till 80 either if you are going to do it. Like, there's the happy point, I think, is the good point is around the 70 mark, and it also depends on other things going on, right? The more other comorbidities, which I know is a word that John loves, the more that there are, the harder these things become from a prognostic standpoint. So,
do you have any clinic that you think does it, so I can probably pop in and have a chat with them and see if you can take it from this end rather than going across the pond to get it done?
No, I don't know of any clinics here doing the stem cells.
You're not planning to do it either, Dr.
No, we're not. I'm not even 100% sure, but I don't think it's fully like licensed and things like that in and cleared by Canada. So I'm not sure. I haven't heard of anybody doing it.
Okay, man. Thank you for your time.
No problem.
Thanks, Marco. Appreciate that. It's want to reach out any further, you know the number, 1-855-55 Dr. Lou, DRLOU, or info@paincarecanada.com. You're not too familiar with the stem cell stuff when it comes to that regard, right? Maybe one day it'll be widely available here.
It's just it's not something that's available here. So it's, and again, the things that I have heard about it, it's very expensive. So how much of it is also just, from a profit standpoint.
Sure.
But that doesn't necessarily mean it doesn't work. It's just I'm being honest, I don't know enough about it. But my cousin here, Remy, who's, again, going back to a big basketball fan, was asking me about the Durant stuff. And since that's an injury, I'm happy to answer. And plus, him studying media studies, this is me just really planning to replace you, John, in the long term. I don't know if you got that hint already.
Exactly. So the whole city wants to know. The big question is, do you think Kevin Durant will be back for Game 2 here in Toronto?
No, he's not.
He will not be back for Game 2. But here's the thing about his injury, because I've had a lot of people ask me about this. So he was diagnosed with a significant calf strain. Yeah. And so really, let's break down what that is. So the calf is obviously a very important area of the body when you're playing basketball, because they're jumping up and down all the time. So it's very important. That's what propels you up and where you land and absorbs the shock as you come down. What a strain is, there's 3 grades of strains or sprains. Sprains apply to ligaments and sprains apply to to muscles or tendons. And so What it is essentially, and the easiest way for me to describe this, there's 3 grades. Grade 1, sprain or strain, is the equivalent to like what you would feel after a workout, right? So anybody that's ever worked out any area of their body and you have that delayed onset muscle soreness, that's sort of a grade 1 sprain or strain of a muscle. Grade 3 would be a complete tear of something. Grade 2 is somewhere in between those two things where it's not fully torn, but it's somewhat torn and it's not healing as well as a DOMS would, which is the delayed onset muscle soreness, which typically can take 24 to 48 hours, maybe 3 to 4 days on the high end, depending how hard that workout was. So the big thing that Kevin Durant here is considering is, could he play right now in a street match? Yeah, of course he probably could. Yeah. But again, going up and down, the thing is these things are progressive. So do you want to potentially make it a grade 3 and then ruin your career? The answer is
next season, right? So
or next season, yeah. And then he's a free agent. He's got a big contract coming and he needs to stay healthy. So I believe with that type of injury, and my prediction will be that based on the fact that of how significant an injury like that is in a basketball player, I actually don't think he'll play in the series, is my prediction on that. I might be wrong, but that's sort of my gut instinct on it because of a lot of things. And calf issues, again, when it comes to basketball, are a very, very significant issue. But we got to take a break, and then we can keep talking basketball after the break.
Beautiful.
Yeah, before we go, if Remy's going to replace me, Remy, do you know the actual official, what's the anatomical name for the calf muscles? Do you know?
Ooh.
Quickly. No?
Nice one, John.
That one
gastrocnemius, there you go.
Not getting replaced.
You ain't replacing nothing,
I might have
buddy.
to hit you with a basketball question after that.
I'm done. 416-870-6400, star 640 on Still time for you to call in to Dr. Payne Show on Global News Radio. You have lots of time indeed. 416-870-6400, star 640 on your cell. You want to reach out. What else you got for me today, pal? Where are we going?
I'm just still impressed about what you pulled out prior to that break. Man. Gastrocnemius. Look at that. Do you know the muscle deep to gastrocnemius?
Huh?
Oh, okay. You're still better. No. You know what's funny? As we were going to break, and then Remy says, he goes, "Oh my God!" He goes, I said that was a good question. He goes, "Yeah." He goes, "I actually thought he was going to ask me the phone number, and I don't know that." I was like, "Oh, you're officially done 100%. Like if you don't know the phone number, which is 1-855-55 Lou DRLOU."
That's next.
Yeah. So it's the soleus muscle, which is deep to gastrocnemius. But anyhow, let's keep going through other joints in the body. We've done shoulder. We've even dealt with the thumb today. Elbow pain, because again, now that the weather's nicer, people are playing their golf and their tennis, and golfer and tennis elbow, which is medial and lateral epicondylitis, traditionally is the name. But as we've continued as a medical profession to do studies on these things, we really see that it's not itis suggesting inflammation. It's not really an itis. It's more of an algia, which is just suggestive of pain. And if we actually look at this, what we call the pathophysiology, so if we understand what's causing the issue, it's actually micro tearing within the muscle and at the where the tendon inserts into the bone, which is called an enthesopathy. So there's no real inflammation going on, but there is obviously pain from that micro tearing, from that repetitive sprain strain, and the management of those issues, which is oftentimes when people initially start feeling it, they feel it more in the bulk of the muscle. As it becomes a chronic issue, they actually start to point closer to the bone. And as that happens, that involves more of the tendon. Tendons are always harder to treat than muscles for one very simple reason, that reason being that muscles have very good blood supply.
Blood flow.
I always say if you look at a picture of anatomy, none of it is by accident. Muscles look red because there's blood flow. Tendons and ligaments look white because there's not very much blood flow. And that hinders the likelihood of healing in that area, because blood brings nutrients, and it also takes away waste products that are produced. So in those instances, we as therapists need to do things to promote blood flow to the area in order to help it heal. And so we have things that are called pain modalities. So these are different tools that we can use to help block pain, versus we have also healing modalities, things that can actually help an issue to heal. And so in those types of instances, we try to work on both the pain modalities in order to control the pain that the person's experiencing. And that could be different types of things, whether it's a TENS machine or a brace that they're wearing to apply pressure. And then we also have the other aspects, which are the the healing modalities, which can actually promote blood flow to the area. And these are things like laser therapy, shockwave therapy, acupuncture does that as well. And those things will actually help the injury to heal. And it's a combination of those two things that is really what helps. It's not mutually exclusive that you either do one or the other, but both have a different place and time depending on the course of the treatment and where you're applying it. So those are important things that we can help with, again, with the seasons becoming nicer and people getting out to play more golf and more tennis. Definitely more likely to see those things happen. And actually, I've seen an influx in the clinic of those things over the last few weeks, just, again, by the very nature that it happens primarily with those two sports because of, again, that repetitive sprain that is presented with either a golf swing or a tennis swing. And then we've gone through, the hand issues. So one of the most common things as we started the show was the carpal tunnel issue. But there's lots of different things. There's even ulnar nerve entrapments, which are the same pathophysiology. It's just not in the carpal tunnel. It's in
the forearm.
Exactly. And so those things can obviously have an effect on quality of life and the things you have to do. Then, of course, we have, the spine-related pain, neck and low back and upper back, which is not as common. But neck and low back, of course, because of there's no rib cage there to support it, so there's an inherent amount of instability and only support through muscular activation. And a lot of these things, again, I could keep going through the Rolodex here of injuries, but it's not all that different the way we treat them. I always tell people in the beginning, it's very much the stuff that someone else can do to you, the passive modalities, whether it's a medication, which doesn't have great research for these types of things, but more the physical and manual modalities that are used, and then moving towards the active rehabilitation, the stuff that you have to do on your own, which is very important.
How about this one before we break? Maybe we'll talk about this after we come back. And that is, I know you mentioned golf season. That involves two things that you love: bending and twisting and rotation at the same time, right? Yeah. It's amazing that more golfers aren't laying flat on the golf green with injury, right?
Well, this is why, like a person like Tiger Woods, who was one of the first golfers to be putting that tremendous amount. If you look at videos of guys from before, it wasn't necessarily the same power. And when you look at the golfers nowadays, they're athletes. They're working a lot on core strength and all these things because they have to use that in order to generate the force to hit the ball as hard and as long as they do. Right. But equally so, they understand that they need to keep that area of their body healthy, which is why they're all in top-notch physical shape. So that's very, very important. And, again, it's fine. You could do those things, but it's always about building strength around the important structures that support those areas for that type of force generation.
We'll get to more of your calls. Still got some time. 416-870-6400, star 640 on cell. In that regard, Mike, I see you hanging there. Just stick around after a short break, and we will get to you next on the Dr. Payne Show, Global News Radio. Last few minutes of the show. You still have a few minutes to call in. That means 416-870-6400, star 640 on cell with any pain concerns or questions you have for Dr. Lou. Mike, thanks for hanging on. Good morning.
Hello.
Hi. Go ahead.
I have a question. I get injured on a slip and fall, and it says I have a tear in my right knee, a LM tear, and I have to do surgery. I got to see the surgeon on July 3rd.
Okay.
But I was wondering if I really have to do. I have pain in the knee, but I was wondering if I really have to do surgery this early because I'm only 49.
I'd have to see what's going on. So typically with the knee, with these types of things, so let me ask you a couple questions. Do you have swelling?
Yes, I do have swelling from last year, August.
Okay, and is there clicking as well that happens?
No, but the swelling hurts.
The swelling hurts, and what about, is there any locking? Does your knee ever lock up?
No.
No, and have you done physio and rehab for it?
I'm still doing physio since last year, August. Up until currently, I'm still doing the physio.
And what type of stuff are you doing? Is it mainly exercise-based, or is it just someone slapping machines on you?
They do exercise, and they put this machine where they put two things on my knees, some electrical.
But you are doing exercise?
Yes.
Okay. Well, I mean, so it's good that you've done it. I'm happy that you're not just jumping to surgery without having done therapy first. If it's a significant enough, it sounds like it's a meniscal tear. If it's a significant enough tear, then surgery might be a good option for it. If therapy hasn't worked, then there's really not much else, in all honesty, that can be done. And it's not like this injury happened 2 weeks ago and you're going for surgery without trying anything else. This has now been progressing over a period of time. It sounds like there's very little improvement. And so is surgery potentially the next option? Yes, maybe. It's very hard, obviously, for me to tell you that to any great degree of certainty because I haven't seen you. So I'm happy to see you, to assess you, to take a look at that knee. And, of course, if there's something else that can be done, I'll make that recommendation. I'm always of the mindset when it comes to my clinical approach that the least invasive measures and conservative things should be done before we move to more invasive and less conservative measures. And, yeah, I'm happy to take a look at that for you.
Okay.
Okay. Thank you.
I would appreciate that. Thank you so much.
No problem.
Thanks, Mike. Appreciate that. 1-855-55-Dr. Lou, DRLOU, or info@paincarecanada.com. Last couple minutes, man. Take it home. Where do you want to go?
Yeah, I mean, I think it's that simple. A lot of people are living with day in and day out with these types of issues. There are also a lot of people, I see a lot of people also for just a second opinion. They're already under care with someone else or another clinic, which is fine. We're not here to take anybody, but people, I guess, have sort of been listening to me for a while. They like my train of thought on these things, and they want my opinion. I'm happy to give that opinion, and I'm very honest with it. If I think the team that you're seeing is doing the very best job that they could be doing, I'm simply going to tell you that. Sometimes what I also do is I'll send back letters to the current healthcare team and say, hey, why not try adding this if you think it's worthwhile? And you know what? Most people are willing to work with someone else and have another idea put on the table. So I'm happy to see people who already have other healthcare providers and already trust them, but maybe are dealing with something, they want to just get another opinion. I've said this a million times on air. I send my own patients, people I see, for second opinions. I often do it like right in that very moment because I'll go into the hallway, grab one of my colleagues, bring them in, and get them to give an opinion. But I do that because, again, I don't know everything, and I'm very honest about that. I'm not an expert on every single thing there is when it comes to injury and pain management. And also, we're all human. We make errors, and we can benefit sometimes by having a second pair of ears or eyes to hear or look at something and see what's going on. And I also try to surround myself with people that I not only think are better therapists than me, but that are also brighter than me, because I do truly feel that that's the way that you get better. And a lot of my success is just simply due to the great team of people that I have around me. And they make me better every single time that I have a dialogue with them. And so, it's an important thing to have humility as a practitioner, and I'm by no means offended when someone wants another opinion, and I don't think anyone else should be either. And unfortunately, I have heard of some people that say, I can't go somewhere else, my doctor will be so pissed off. Wow. It's not the right approach. Let's work as a team, and we're working with one goal, to get you, the patient, better. So give me a call, and happy to help you through any of your pain and injury concerns.
Good way to wrap it for today, brother. And go easy on the video games there, okay, Ray? Until next time. So keep those marks up because I live right beside the college. I can check on you. I'm just saying. 1-855-55-Dr. Lou, DRLOU, info@paincarecanada.com. Thank you for all your contributions. Till next time, the Dr. Payne Show on Global News Radio.